Next for the clinical examination of the respiratory system, next is percussion and auscultation. Now percussion is rule of percussion কি সবার আগে জানতে হবে. What is the rule of percussion? Percussion is from the front, from the side and from the back. ঠিক আছে, from the front যখন করব, then head should be, two hands should be by the side of the body. হাতটা এরকম ভাবে রাখুন এইখানে, ঠিক আছে, এভাবে রাখবেন, ঠিক আছে. Percussion should be along the, from the front, mid clavicular line, ঠিক আছে. Here from the side this is mid axillary line, and from the back scapular line. Now rule of percussion key. Now two term, one is pleximeter finger, number two is flexor finger. This is the pleximeter finger, and the middle finger on the left hand, and this is the flexor finger. Now this finger should be kept over the intercostal space, ঠিক আছে, and other fingers of the hand should not touch the body surface, ঠিক আছে. This is the normal principle. So this is the rib space. As always, as I had discussed earlier, percussion should be along the rib space, about intercostal space, but auscultation and palpation and the auscultation and palpation, this is along the area of the lung, as I had discussed earlier. So this is like a percussion is a principle. So you keep this finger in the intercostal space, other fingers should not touch, and this is the flexor finger, and movement should be from the wrist, not from the whole hand, whole upper limb. So movement should be from the wrist. So and after percussion, immediately after percussion, you remove your finger. So this is the pleximeter finger, this is the flexor finger, movement should be from the wrist. And now next is always examine or percuss the normal side first. Suppose you are suspecting this is a case of right sided pleural effusion, then always percussion should be at the intercostal space, first the normal side, and then always compare the both side. Okay. Now tell me, what is a normal percussion of the lung tissue? What should be normal? What is a normal percussion? Normal percussion of the chest. What is the exact term? Normal percussion is resonant, and abdominal percussion is tympanitic. So it is a normal percussion is resonance. Okay. Now what are the abnormal percussion tone? Okay. Now suppose this is a pleural effusion, what should be the percussion tone?
Dull.
So dullness. Impaired, dull. Now there is a typical term for the pleural effusion, which is stony dullness. Next, if it is pneumothorax, so it should be hyperresonant, not the tympanitic, because tympanitic term is only specific for abdomen. So it's a hyperresonant. And if it is a fibrosis, thickening, it should be impaired. ঠিক আছে? So this is a percussion. Now first is percussion over the clavicle. Okay. Usually you stretch the skin over the clavicle at the medial 1/3 and lateral 2/3 at the junction. This is the direct percussion. In the clavicle, do not keep your pleximeter finger. It is a direct percussion, like so. We are suspecting a case of right sided pleural effusion. First, this part, stretching this part. Now this. এটা প্র্যাকটিস করতে হবে রেগুলার. ইউ শুড প্র্যাকটিস দ্য পারকাশন, আদারওয়াইজ ইউ উইল নট গেট দ্য এক্সাক্ট টোন. সো হোয়াট শুড বি দ্য প্রসিডিওর? লাইক ইটস এ নর্মাল সাইড, you can hear for the heart here in the mediastinum, you should keep your hand slightly laterally in the left side. Okay. এই আওয়াজটা কিন্তু পরীক্ষায় চাই, ঠিক আছে? তাহলে আমি জাস্ট একটা সাইড, আমি জাস্ট শোয়িং দ্য ওয়ান সাইড হিয়ার. From here it is impaired. If you count the space, second rib, second space, third space, fourth space, fifth space, around fifth or sixth space, around the fifth or sixth space along the midclavicular line, this is impaired. This impairedness due to liver dullness. So this is the percussion in the front. Now from the side axillary area. Now the axillary area starts from 4th to 8th space. Okay. কি করব? হাতটাকে কি করব? এখানে রাখবো. আপনি হাতটাকে এখানে রাখবেন, ঠিক আছে? এই তাহলে সেম প্রসিডিওর, ফার্স্ট নর্মাল সাইড ফার্স্ট অ্যান্ড অ্যাবনর্মাল সাইড কীভাবে করবো, সেম জিনিস, বাট পরীক্ষাতে কিন্তু নট লাইক দিস, not like this. First normal abnormal compare with the normal side axillary area. Now from the back কি করে করব, আপনি হাতটাকে বলতে হবে এরকম দিকে, এই শোল্ডার টাচ ইওর শোল্ডার্স এবং ঝুঁকে একটুখানি ঝুঁকে যান, জোরে করে একটু ঝুঁকে যান। ইওর স্ক্যাপুলা উইল বি সেপারেটেড, দেন actually here like a fishbone pattern, this is the percussion. There are three things how to counter the rib space, intercostal space in the percussion. From the axillary area starts from the fourth to 8, from the scapular area, inferior angle of the scapula, this is the inferior angle of the scapula, it corresponds with the D7. Very good. So inferior angle of the scapula corresponds with the D7. Very good. And from the front, the sternal angle, you know the sternal angle, then it corresponds to second rib, then it onwards, second space, third space, fifth space. হয়ে গেল। তাহলে পারকাশন ব্যাপারটা ক্লিয়ার। নর্মাল অ্যাবনর্মাল, ফার্স্ট it is the first it is the mid clavicular line, your axillary line, and from the back it is the scapular line. Next, what are the findings? I had already discussed what are the abnormal findings in percussion. Next, two important percussion you should know. One is chronic isthmus, chronic KRONIG, chronic isthmus or apical percussion. Apical percussion should be like this. Here, what is the boundary of the apex? Usually, what is the boundary of the apex of the lung? It is the clavicle, anteriorly, posteriorly, trapezius. Here the acromion process, here the scalenus medius. Okay, so this is the apex of the lung, apical percussion or chronic isthmus is like this. It is impaired usually in any tumor or pancreas tumor, apical tumor of the lungs, it is impaired, or any fibrosis due to tuberculosis. So apex of the lung percussion is important. It is finger position like this. Three percussion should be done: normal, abnormal. Okay, apical percussion. Another is how to differentiate pleural diffusion from hydropneumothorax. So there is one term. This is called shifting dullness. Shifting dullness. So what is the usual procedure for the shifting dullness? You percuss the lung anteriorly in a sitting posture. Okay. Suppose this is a case of pleural hydropneumothorax. So what is the meaning of hydropneumothorax? The lower portion of the pleura is filled with water and upper part is air. So hydropneumo. So here if we percuss, suppose there is a dullness from the fourth intercostal space onwards. Dullness. So this dullness is due to, some part is due to fluid and upper part, suppose above the fourth space there is air. Suppose fourth space or fifth space is due to junction of the air and fluid. Now if we supine the patient কে বলবো আপনি শুয়ে পড়ুন, patient শুয়ে পড়লো, patient previously was in the sitting posture, then in the lying down posture. In the lying down posture, the whole part, like patient যদি শুয়ে পড়ে, আমি শোয়াচ্ছি না, আপনি যদি শুয়ে পড়েন তাহলে এই just patient was like this, now this, but the upper part will be air. Then if we percuss, then the normal dullness will be shifted. This dullness will be converted to hyperresonant. Clear? So this is called the shifting dullness. Dullness will be shifted just like in ascites, dullness will be shifted. One important question just for examination, if there is a question, if shifting dullness is present in pleural diffusion or not. Yes, shifting dullness is present in pleural diffusion also, but it is delayed. But immediate shifting dullness in lying down posture is due to hydropneumothorax. Very good. And another is a trough space. What is a trough space? TRAUBS. One is chronic isthmus, that is trough space. The left sided part, it is the draw two vertical line, like a two vertical line, one along the sixth sixth rib at the costochondral junction, like a sternal angle, second space, third, fourth, fifth, sixth. So these are sixth rib in the costochondral junction down the vertical line. One is along the sixth, 7, 8, 9. 9 rib along the mid-axillary line. 2 lines and 2 horizontal lines from the costochondral junction from here. This part in the left side of the thorax is called a trough space. Trough space content there is this spleen, left lobe of the liver, fundus of the stomach, left lower lobe of the lungs. So this trough space percussion will be impaired due to, so trough space percussion is very important. Trough space percussions if become dull, that means the content of this space, there is a disease of the content of this space, like there is a left sided pleural effusion, okay, left lower lobe effusion or left lower lobe consolidation, left lower lobe fibrosis, then this part will be impaired. Next, if there is a CA stomach, this part will be impaired. If there is a splenic pathology, splenic abscess or something, or splenic enlargement, this part will be impaired. So trough space percussion is important. Chronic isthmus is very important. Clavicular percussion, direct percussion from the front, from the back, from the side is important, and comparison from the from normal to abnormal is important. So this is all about the percussion. But always you should practice. একবার করে দেখবে, একবার করে দেখো, just percussion, just percuss this part করে দেখাও একবার. Clavicular is ঠিক আছে, okay. Now the percussion and the intercostal space. First keep your finger over the not over the rib but over the intercostal space. Yes, this finger no করো. Yes, actually this finger should be touched, entire finger should be touched, otherwise you do not get the sound, you do not get the note. Okay, আমি এবার দেখাচ্ছি, জাস্ট মোটামুটি এটা অভ্যেস সবাইকেই বলছি, আমার এমবিবিএস স্টুডেন্টের জন্য বলছি, অলওয়েজ প্র্যাকটিস। পারকাশন ইজ অলওয়েজ মানে এই টোনটা চাই, এই টোনটা না হলে হবে না পরীক্ষাতে, এই টোনটা করতে হবে, ঠিক আছে? এই ধপধপ করা, দিস ইজ দ্য অ্যাকচুয়াল টোন অফ দ্য লাং রেজোনেন্ট, দিস টোন ইজ ইম্পর্টেন্ট। হয়ে গেল পারকাশন, দিস ইজ অল অ্যাবাউট পারকাশন। Now for our MBBS student, you study, if any problem you contact me. Now there is auscultation. Auscultation is front, side, back, same procedure, but auscultation should be along the area of the lungs, like suprascapular, here is a mammary, inframammary, supraclavicular, infraclavicular, axillary, infraaxillary. Auscultation along the area. Now what are the breath sound? What are the different type of breath sound? Mainly one is bronchial and vesicular. What are the main criteria of the vesicular breath sound?
There is no inspiratory gap.
So there is a no. So first is character. What is the vesicular? So it is a low pitch rustling in character. Low pitch rustling. Number 2, there is a no gap between inspiration expiration. Number 3 is more than expiration. Very good. So normal lung tissue is normal, very vesicular. Now what is the bronchial breath sound? This is a high pitched. High pitched, there is a definite gap, and inspiration and expiration duration usually equal. So this is a bronchial breath sound. Now in normal lung, normal patient, where you will get a bronchial breath sound? কি করে বুঝবো কোনটা bronchial breath sound? What the trachea. If we কানে দিচ্ছি না for our safety purpose, so we will keep our stethoscope diaphragm over the trachea. শ্বাস নিন. This sound is bronchial in character. Now why this sound is converted here to this low pitched sound? Why? Just remember one sentence for your entire life. The normal sound produced is bronchial breath sound, but our lung tissue acts as a low pass filter. Lung acts as a low pass filter, so it will allow to pass the low frequency sound. Now this normal architectural pattern of the lungs will be lost in consolidation. Okay, so lung tissue acts as a low pass filter, therefore here we will get a high pitched sound, this is bronchial breath sound, but in the lung tissue, lung parenchyma, the sound will be low pitched, this is the vesicular breath sound, but in a disease condition like in pneumonia, consolidation, there is a normal architectural pattern of the lung tissue will be lost. So lung cannot act as a low pass filter, therefore in consolidation we can hear the bronchial bed sound. ব্যাপারটা হয়ে গেল। ইন কনসলিডেশন আমরা ব্রঙ্কিয়াল বেড সাউন্ড শুনতে পাচ্ছি কেন? কারণ লাংয়ের নর্মাল টিস্যুটা নষ্ট হয়ে যাচ্ছে, তাই লাং অ্যাক্ট এজ এ লো পাস ফিল্টার। এই কথাটা পরীক্ষায় জিজ্ঞেস করলে বলতে হবে লো পাস ফিল্টার। এটা অনেক বড় মেকানিজম, জাস্ট একটা কথা, লাং অ্যাক্ট এজ এ লো পাস ফিল্টার। ঠিক আছে না? কী করে শুনবো আমি? আচ্ছা দুটো, জাস্ট এভাবে আপনাকে বলবো পেশেন্টকে আপনি মুখটা বাঁদিকে ঘোরাবেন, ঠিক আছে? আর এক্সামিনেশন অলওয়েজ ইন দ্য সিটিং পশ্চার, মুখটা বাঁদিকে ঘোরান, শ্বাস নেবেন, শ্বাস নিন। Like I suspect in a case of right side effusion, always compare with the normal side first. Sas, sas, sas. Very good. Sas, 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 sas. আচ্ছা এদিকে শ্বাস, এদিকে হাত, হাত, শ্বাস। একই ব্যাপারে যখন আমরা অ্যাক্সিলা করবো তখন আলাদা করে বলবো আপনি হাতটা এখানে রাখবেন, ঠিক আছে? দিস ইনস্ট্রাকশন ইজ ভেরি ইম্পর্টেন্ট। শ্বাস, শ্বাস। যখন ব্যাকে দেখবো তখন হাতটাকে এরকম করুন যেরকম শিখিয়েছি, করে শ্বাস, 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 শ্বাস। এই হচ্ছে ব্যাপার, ঠিক আছে? হোয়াট আর দ্য অ্যাডভেন্টিশিয়াস সাউন্ড কী পেতে পারি আমরা? হুইজ বা ডঙ্কাই, ক্রেপিটেশন। হোয়াট ইজ হুইজ? Is a musical sound, okay? Wheeze, like a this part is wheeze. This is a wheeze or donkai. It usually indicates there is an obstruction. This is in an obstructive airway. It is like asthma or COPD. We will get the wheeze. Now the crepitation. Where we will get the crepitation? Fibrosis or the basite tube. If there is a fluid, if there is secretion, then we will get the if the basi is obstructed, then we will get the music. This is called the ronkai. If there is a fluid, then we will get the sound of crepitation, creps. Like in consolidation, there are various stages: gray hepatization, red hepatization, resolution. Like in pneumonia resolution, there is a fluid in dissolving stage, then you get the crepitation. This is a crepitation. Or in interstitial disease, interstitial lung disease, you will get the crepitation. Usually the term is end inspiratory crepitation in bilateral in infrascapular area. ঠিক আছে, so crepitation and the rub. হ্যাঁ, this is called the end inspiratory creps or velcro creps. It is typical for ILD, typical for interstitial lung disease. The ILD term is obsolete. Now term is, what is the term? DPLD, diffuse parenchymal lung disease, DPLD. ILD এখন কেউ বলে না, DPLD বলে, ঠিক আছে? তাহলে এটা যে ক্রেপস হলো, নেক্সট রাব, প্লুরাল রাব। রাব মিনস যে ফ্রিকশন বিটুইন টু লেয়ার্স অফ দ্য প্লুরাল রাব। আমি মানে আই সাজেস্ট ফর স্টুডেন্টস দেয়ার ইজ এ ইউ ক্যান লিসেন ভ্যারিয়াস টাইপস অফ অ্যাডভেন্টিশিয়াস সাউন্ড in YouTube also, okay? Or you contact with me, you will listen different types of sound, ronkai, crepes, rub, okay? The two important points of rub কোথায় পাবো? Rub হচ্ছে rub is when the patient suppose is complaining of chest pain, is a pleuritic chest pain, it is increased during inspiration, expiration with fever, there is a pain, and you will get suddenly there is a frictional sound. This is rub. The important point is, suppose ও বললো স্যার আমি এখানে রাব পেলাম, আই ক্যান লিসেন হিয়ার এ রাব, অ্যান্ড ইনস্ট্রাক্টেড ইউ প্লিজ লিসেন, তুমি শুনে দেখলে এখানে নেই। ইট ইজ এ ইম্পর্টেন্ট ফিচার। রাব ইউজুয়ালি পাবো না, ঠিক আছে? পেতে পারি না পেতে পারি, ডিসঅ্যাপিয়ার করবে, ঠিক আছে? দিস ইজ এ রাব। ক্রেপিটেশন ইউজুয়ালি প্রেজেন্ট, অ্যান্ড ইফ ইউ দের ইজ এ কনফিউশন, যদি কাশতে বলবে দের ইজ এ কাফ, আফটার কাফিং ক্রেপিটেশন ইউজুয়ালি রিজলভস, ইয়েস। সো ক্রেপিটেশন রাবস। Next, the only important point is vocal resonance. Vocal resonance is nothing but auscultation of the vocal apparatus. So vocal resonance is the auscultation of the vocal apparatus. কিরকম করে করবো? পেশেন্টকে বলবো 3-3-3 বলুন অথবা 9-9-9 বলুন। আচ্ছা আপনি হাতটা রেখে দিন, মানে মুখটা দিকে ঘোরান, আপনি বলবেন 3-3-3। যখন আমি এটা আপনার এখানে রাখবো আপনি বলুন। আচ্ছা সাপোজ আমি কম্পেয়ার করছি দিস সাইড, বলুন হচ্ছে। এটা কি লিখবো? ভোকাল রেজোনেন্স। কী হবে? আচ্ছা কখনো পরীক্ষায় ইউ ডু নট সে, পরীক্ষায় অনেকে বলে তাহলে ভোকাল ফ্রেমিটাস ইজ নর্মাল বাট রাইট সাইডে ভোকাল রেজোনেন্স ইজ ইনক্রিজড। কখনো হবে না। অলওয়েজ ডু এ ব্যাক ক্যালকুলেশন in every condition when the vocal resonance is increased or decreased, vocal fremitas will be also decreased. Okay, ব্যাপারটা বোঝা গেল? না এরম বললে হবে না যে ভোকাল ফ্রেমিটাস, আচ্ছা ভোকাল রেজোনেন্স কোথায়, রেজোনেন্স কোথায় বাড়বে? ভোকাল রেজোনেন্স উইল বি ইনক্রিজড ইন consolidation. Very good. তাহলে vocal resonance increased. If you say there is a vocal resonance increased, then you have to prove where there is a consolidation present or not. Then you should get a bronchial breath sound. কখনো বলবে না pleural effusion, vocal resonance is increased, vesicular breath sound. Chest examination is always like a mathematics calculation. ঠিক আছে, এই ক্যালকুলেশনটা মাথায় রাখতে হবে। So vocal resonance is increased, then you should get a bronchial breath sound. Okay. In pleural effusion কি হবে? Diminished. Diminished. In pneumothorax, in pneumothorax, this is very important. In pneumothorax, the percussion note will be hyperresonant, but lung tissue will be covered by the air. So vocal resonance will be decreased. Breath sound will be decreased. Okay. So in pleural effusion, vocal fremitus decreased. Vocal resonance decreased. In consolidation, vocal fremitus increased. Vocal resonance increased. You will get a bronchial breath sound. আর একটা ইম্পর্টেন্ট পয়েন্ট বললাম, if there is a shifting dullness, if you are suspecting a case of hydropneumothorax, then after percussion, suppose there is a dull part or impaired part, and from there is from a hyperresonant part and then dull part, then at the junction of the air and fluid, you in axillary area or from the back, you keep your stethoscope like this part is hyperresonant due to air part, and this part after percussion, and this part is impaired or dull. Then at a junction you keep your diaphragm of the stethoscope here and you just shake the patient. Actually these are the old procedure where the X-ray was not available. So then you will listen a sound, splashing sound. This is called the succussion splash. So two important points, this will be asked in the examination. Two important questions, two important differentiating points in hydropneumothorax. One is succussion splash and number two is shifting dullness. ঠিক আছে, চল শেষ।